We just heard from a local nurse whose life has changed since her COVID-19 diagnosis last summer. Here was some perspective on the rate of infections, vaccinations, and an experimental pill that eradicates symptoms in COVID patients is Dr. Lucinda Demarco, Chief Medical Officer for UnitedHealthcare of South Carolina. Good to see you again.
Good to see you too, Leyla. Thank you
Still-
for having me.
Still staying healthy?
I'm trying. I did get my first COVID vaccine, though.
You're going for the two-shotter?
I'm going for the two-shotter, yes.
Can you tell us which one of the two?
Yeah, I got Pfizer.
You did, okay. And so far, so good?
So far, so good. I got it almost a week ago now, and in all honesty, I had no side effects at all. My arm wasn't even sore, which I expected it to be. So
When
it
you
was
get
all
a flu
good.
shot, your arm's killing you, right?
Yeah.
Now, we just
Absolutely.
spoke to a nurse who is considered, this term is called a long hauler, and she had contracted COVID late June of last year. She still to this day is suffering from various health problems. How common is this?
I think it's becoming more common than we thought it was. You know, I think initially, and it's like everything with this disease, you know, as time marches on, we learn more and more and more about it. And, you know, there's things about it that I think we didn't expect. And so, you know, it's becoming more evident that the long hauler is there and is here to stay. We don't know really because it's a relatively new, I'm going to say diagnosis or acceptance. We don't really know how long it's going to last. You know, it may cause permanent damage to their varying systems that it affects for the rest of their life.
And that's what she's saying she's experiencing. Now, there is a pill that is currently in trials. I want to talk about that in just a moment. But first, let's talk about the vaccinations that are currently on the market. We've got two that are 2 doses, and we've got the Johnson & Johnson vaccination that's just been released. Can we talk about, just briefly here, the 2 that are currently on the market that are the 2-dose vaccinations?
The 2-dose vaccinations at this point, one is Pfizer and the other is Moderna. Pfizer was the first one to get EUA or emergency authorization, and then Moderna came behind it. I think it was about a month later. Both of them are 2 shots. You go and you get your first shot, and then now, initially, Pfizer was supposed to be 21 days later, but I think for convenience sake, they've said both of them now will be 28 days later. And that falls within Pfizer's window of 21 to 40 days that you have to get your second one. The interesting thing is there's several things to remember about the 2-dose vaccines. One is that you do get some protection within 7 to 14 days of that first shot, but it's not the maximum that you can get that they found in their clinical trials. So you may get like 80% efficacy. The key, though, is you need to get that second booster shot because you're not going to have the full immunity that you need. Key, though, is it's all based on how your body responds and responds to the pieces of the vaccine or the pieces of the virus that are in these vaccines, and that's what determines how many immunizations you need.
Well, I just want to talk real quickly about the Johnson & Johnson vaccination because that has actually raised some eyebrows and some concerns among some of our community leaders. The Johnson & Johnson vaccination is a 1-dose vaccine. It doesn't have to be kept in freezing temperatures the way the other shots do. But this is a statement that we received from the Roman Catholic Diocese of Charleston. They say it is morally acceptable to receive any of the 3 COVID vaccines. However, because the Johnson & Johnson vaccine was developed, tested, and produced with abortion-derived cell lines, if given a choice, one should choose the Pfizer or Moderna vaccine over the J&J. So there are some morality issues that have now come into play, which is something that a lot of people don't realize or don't even think about. Real quick, we only have a few seconds left, Dr. Lucinda, but there's also this pill that they're now in trials that someone who's diagnosed with COVID can take over 5 course dose, and it eradicates symptoms. So are we seeing possible light at the end of the tunnel for people who have just been diagnosed?
Well, we sure are hoping. You know, there's several things that are out there. One is an infusion that if, you know, you have an oxygen requirement, you're at risk. There's a whole list of requirements to be able to get an infusion you get several of them, and it can help mitigate the symptoms. And I think the hope is that this pill is going to do that as well. There's definitely positive outcomes in the small trials they've done, and it's now being done on a much larger front. So we'll see. As the saying goes, stay tuned, because tomorrow the story may be different.
That's right. And keep wearing your mask. Dr. Lucinda Demarco, thank you so much for joining us.
Thanks, Leyla.
We're back after this.